Alright, my name is Daniel Forte, and today I'm going to be talking about getting into the field of physical therapy. So I'm going to start by talking a little bit about myself. So I'm 24 years old and majoring in kinesiology here at SAM. Some of my hobbies include playing soccer and running, and these hobbies are actually kind of what influenced me to get into the field of PT. And this is because back in 2014, while playing soccer, I tore my ACL and I needed to get surgery. And so the recovery and rehabilitation I went through, which was aided by a PT, kind of helped me see how PTs help people regain mobility and kind of get athletes such as myself back to playing the sport. And so this kind of inspired me to become a PT as well, so that I could also help other athletes and just other people in general kind of get back their mobility and their day-to-day lives. So getting into physical therapy, there are certain requirements that you need to go through before you can become a PT, and the first and foremost is getting your bachelor's degree. So you can get your bachelor's in any field, but it's typically recommended to get your bachelor's in a related field to physical therapy, such as kinesiology or athletic training. So once you complete your bachelor's, you move on and you apply to a PT school where you go and try to and get your doctorate of physical therapy, and this usually takes around 3 years. However, before you can start practicing, you need to take and pass your state licensing exam that lets you practice in a certain state wherever you may be trying to practice in. And so once you pass this test, you're considered a generalist. And so after this, you can further your education. You don't have to, but you have the option to specialize. And so what specialization means is that when you're just fresh out of passing your state licensing exam, you're considered a generalist, and that means you can practice in any of the fields of physical therapy, any of the 9 fields of physical therapy. And so you can specialize in one of them, and this helps you better treat patients within those fields that you couldn't really, would have complex issues that you wouldn't be able to treat as well as if you were still just a generalist. So moving on to salary, typically right now the average salary in the U.S. for a physical therapist is around $88,000 a year, and in the state of Texas this is a little bit higher. The average in Texas is around $91,000 a year, and just in general, the average salary varies from state to state, and some states have higher pay, some states have lower pay. So the career outlook right now, the field of physical therapy is growing. It's generally a positive one. So right now it's growing it's expected to rise in by 22% from 2018 to 2028. So this roughly translates to 16,900 new jobs within that time frame. And so with this is usually because PTs are always in high demand. So people are always growing old and need PTs, or athletes will always get injured and need PTs for their recovery. So the job is always in demand. And so this makes the job search rather easy. And in fact, most students have a job before they even graduate from PT school. And this, again, is because just jobs are everywhere. They can be found online on websites such as Indeed.com or just at job fairs. So, for example, employers will sometimes go to your school and host a job fair looking to employ those recent graduates and give them jobs in PT, like fresh out of school. So that just makes it easy to find a job. Moving on to benefits and challenges of PT. So some of the benefits, as we've just discussed, is job security. Jobs are everywhere. There are more jobs being introduced, and so that just kind of plays a role in job security because they're everywhere. They're easy to get. Moving on, the hours, they're not that intense, so it's not like doctors who have pretty intense hours. Physical therapists are usually working 9 to 5. Sometimes they stay later than that just to work on paperwork, and they rarely work weekends. Just every now and then when they have that one patient who can't make it within the week, and so they have to come in at a certain time on the weekends. Another benefit is just your selection in setting. So there's a variety of settings where you can work in as a PT, and you have plenty of options. You can work in a hospital, you can work in a clinic, you can work in a private practice, and so on and so forth. There's plenty of options. You have lots of options. Now moving on to some of the challenges of physical therapy. One of the challenges is just managing people. So managing people can be tough because you want to coordinate and be able to work with people for the benefit of the company and for the patients. And just in PT school, they don't really teach you management, and so that can be a bit of a challenge, getting used to working together with others. And then moving on to one of the bigger problems in physical therapy, one of the bigger challenges anyway, is dealing with paperwork and insurance. And it's because in the health field, you deal with mountains of paperwork, and then you add in insurance who are looking over these mountains of paperwork and looking for the slightest of errors, because they look for errors so that they can deny patient claims, and that way they save money because they don't have to pay for those claims made by the patient. And so you already, on top of having lots of paperwork to do, you have to make sure all this paperwork is done accurately, and that can be frustrating and challenging. And finally, there's also uncooperative patients. Now, there are some patients who they don't believe they'll get better, or that they don't think the treatment is going to work, and so they come into physical therapy with just a negative outlook, with negative expectations. And so when you try to tell them to do certain things at the practice, or when you tell them to do things at home, they don't do it and they don't get better, and it's just challenging to work with these kinds of patients who aren't cooperating with you. And so far, those have been some of the ins and outs of physical therapy that I've seen through my research this semester. And so it's shown me some of the coming challenges and the expectations that you can expect from a career in physical therapy, and it's shown me that some of the challenges that I'll have to face in the future. And here are some of the challenges that I'll have to face and that I can expect to face on my path to physical therapy. Is first and foremost getting into PT school. Now, getting into PT school, it's not easy. We know that you need to have a high GPA, you need to have a certain amount of hours or observation hours to be noticed by the schools, and so that's a challenge to get into PT school. And then even when you get into PT school, paying off student loans. PT school is expensive, and you might have to take out a loan, and then paying back that loan will prove to be a challenge as well. Again, on the topic of being in PT school, keeping good grades, that can be difficult, because as we all know, it's not easy. Being in PT school, it's grad school, it's hard, and so keeping up good grades will be a challenge. It should be a challenge. And again, all of these factors combine in giving you stress, and stress in general is a challenge that we're going to have, and many people can attest that being in PT school will just be stressful. Paying back the loans is stressful, keeping your grades is stressful, just applying to schools can be stressful. And so these are just some of the things that I can look forward to, or that I can expect to look forward to in the future. And so now we've made it back to my final thoughts here on physical therapy in general, and this research in general. And overall, I think this research has been very useful to me to know what to look forward to career-wise. And it shows me like I said, it shows me the coming challenges that I'll have to face in my career, in both professionally and academically. And it's shown me the kind of the short-term goals, the long-term goals that I can expect to set and to kind of face and try to achieve. And so for example, a short-term goal would be graduate from SAM with a high GPA, and it's because obviously you want a high GPA and to be able to get into grad school, and that which would be the following step after you graduate from SAM, getting into PT school, and that's another goal that you can expect to have. And so again, this research has just been beneficial for me, because now I know what to expect, the kind of qualifications I'll need to get into PT, and it lets me know and it lets me prepare better for the future. And so that's why this research project has been very beneficial for me. And yeah.